The integration of services between the Primary Care Trust and local authority really started about 18 months ago. The idea was to make sure that we could provide a more whole service for people, recognising that they had both health and social care needs. Well, I think in some ways it's early days, to be honest. You can't just put services together and just assume they're going to work effectively in a different environment. And one of my messages to staff and to people that we meet is that it's very much about how staff across the service take forward the opportunities of integration to do things that they perhaps have always been challenged about in the past. I'm really proud of some of the things that have been happening within adult services. We have done really well this year in winning a huge and very competitive programme of something called a whole system demonstrator work for the Department of Health, which is all about providing tele-health solutions for people to help provide support and care for people with long-term conditions. But it's not just about the big things. I'm just as proud of some of the smaller scale initiatives that mean so much to people on the ground. We've done some good work around introducing health MOTs to people that attend various of our day services. We're doing some great work around properly signposting support for people with a substance misuse or alcohol problem in the A&E department at Newham University Hospital Trust. We're also doing some good work there around improving our urgent care services and how we can work more collaboratively with the local GP out of hours co-op and the Newham University Hospital Trust Emergency Department. That's what I want to encourage. I want people to find those very local things they can do where they can really make a difference and build really strong and effective bridges between people in the adult social care world and within the health world. We're about to start the planning process for 2008-9 in the near future, and one of the things we really want to do is to find ways of getting staff much more involved in that process, because we're absolutely sure there's loads and loads of really good ideas out there. As well as the ideas, we also want to hear from staff about and think about the resource implications of taking those ideas forward. We won't be able to do everything at the present time. There's a very big agenda for us at the moment, but we do want to make some space for the problems that people would like to tackle. I believe very strongly that just expecting managers to come up with ideas on their own and try and move those forward is not necessarily the best way of doing things. I'm very conscious of lots of really good imagination and innovation across the service, and what I would like the integrated service to be doing is giving people an opportunity to really push those ideas and make them real. So over the next 4 or 5 weeks or so, the group managers with team managers are going to be working with staff across the whole adult service to really try and pick up on those ideas and work out which of them we can take forward. My message to staff is to look out for any opportunity going, really. We're going to be taking forward a programme of identifying some change facilitators in both the local authority and the Primary Care Trust. And those people will be helping to use and deploy their skills, perhaps in different areas to the place that they normally work. And with some good training from City University and some good encouragement from their colleagues, I'm sure that there'll be some really good opportunities coming through that for people to help pull together the health and social care expertise that we have within the service as a whole.